Knock, 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 knock. I'm doing my hand hygiene and I'm going to do the patient privacy. I'm going to close the curtain and I'm going to make the bed lowest position comfortable with me. And good morning. I'm Sunita Vasmith, student nurse from TCCD. Today I'm here to perform the head into the assessment. That means I'm going to inspect your head, leg, hand, and I'm going to listen your lungs, heart, and tummy. Okay?
Okay.
And can I have your name and date of birth just for the patient verification?
Okay. My name is Ishan and my
date
date of birth is August 14th.
Thank you. Yeah. And now I'm going to ask the several questions that helps me to check his level of consciousness. Do you know what's your name?
Yes.
What's your name?
Ishan.
What's your date of birth?
2009, August 14th.
And who brings you here today?
My dad.
And do you know what it is today?
Yes.
What it is today?
It's February 5.
Okay. And do you know where you are right now?
In hospital.
Hospital. Okay. He's conscious with the time, place, situation, and person, and he's the awake and alert. And now I'm going to stage him according to the Piaget and Erickson. According to the Piaget, he's the concrete operational developmental stage, and according to the Erickson, he's the industry versus inferiority stage. And he told me he's using the max, and he told me he's washing his hand every time when go outside. That means he's more careful with that, and he said he's using the booster seat while he's in the car. That means he's more careful and he's focused on the safety also. And he's a 10 years old. He's a 10 years old boy. And now I'm going to ask his the pain level. Do you have any pain right now?
No.
No pain. And according to the flex skull and faces, and his face is smiley and no grimacing, and his leg is relaxed and activities are normal, and he's no crying. And I can say that I can rate him 0 to 2. That means he don't have any pain. And now I'm going to start my head into the assessment. Okay.
Okay.
First I'm going to inspect his head. There is no lesion, no bump, and it looks the normal and clean. Now I'm going to check his face. Both sides is equal and symmetrical in his face. And now I'm going to check his eyes. I'm going to shine my light in your eyes. Please look straight. Okay.
Okay.
Okay. His eyes pupils is round, equal, and reactive with the light. His sclera is white and conjunctiva is nice in pink. Now I'm going to check his accommodation. Okay. Can you follow the P? Yeah, accommodation present bilaterally. That's normal. Now I'm going to check his ears. First I'm going to inspect. There is no redness, no swelling, no drainage, anything. Yes, it's normal and it's the symmetrical. Both are symmetrical, and its deformity is good and position is good. Now I'm going to check the inside. Okay. He's more than 3 years old. That's why it's up and back. It's inside, it's a normal. Up and back, it's a normal. Okay, now I'm going to move to the nose. And nose, there is no any redness, no swelling. It looks normal. And do you have any drainage from your nose?
No.
You don't have any drainage. Now I'm going to ask you to close one nose and blow gently from the another nose. And can you do vice versa? I'm going to check the patency of the nose.
Okay.
Do you feel any difficulty while doing that?
No.
Okay, his patency is good and there is no drainage. And look the inside. The nasal mucosa is nice and pink. Now I'm going to move to the mouth. Okay. First I'm going to inspect the lip. There is no any blue color. That means there is no sign of sinuses, and his lips is a little bit dry, maybe because of the weather. Now I'm going to see the inside. Okay. Can you open your mouth? Oral mucosa is nice and pink, and no lesion, no sore, and no broken teeth, and gum is clean and intact. Now, do you have any problem with the swallowing?
No.
Okay. Now I'm going to move to the neck. Can you move your head up and down and side by side?
Okay.
Do you feel any difficulty while doing that?
No.
Okay, and his range of motion of the neck is good. Now I'm going to check the jugular vein distension, and I'm going to listen the jugular vein. There is no burst sound, and now I'm going to there is no any lumps in his neck, and I'm going to feel the carotid pulse. Yeah, he has the good pulse. Now I'm going to listen his heart. Now I'm going to listen your heart. Okay.
Okay.
Aortic, pulmonic, second intercostal, arc point, third, fourth intercostal, tricuspid, and apical pulse, fifth intercostal, and mid-clavicular line. I'm going to listen the full 1 minute. His pulse is 86, that means normal. Now I'm going to move to the chest. Do you have any cough today?
No.
And do you have any shortness of breathing?
No.
No? Okay, now I'm going to listen your lung sound, anterior and posterior, okay?
Okay.
And his heart sound is normal, and S1 and H2 sound present clearly, and he's not using his accessory muscle for the respiration. That's good. I'm going to listen the zigzag motion. Take a full deep breath. Can you take a deep breath? Can you take the deep breath? Can you take a deep breath? Can you take a deep breath? Deep breath. Deep breath. Deep breath. His anterior lung sound is clear, and clear, no crackle, no whistling. That means his lung sound is normal. Can you turn this way? I can listen the next posterior lung sound. Thank you. Can you take a deep breath? I'm listening the zigzag motion. Can you take the deep breath? Deep breath, please. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, thank you. Good job. And his posterior lung sound is normal. Now I'm going to move to the abdominal part. Okay. First, I'm going to inspect. There is no lumps. There is no redness, no swelling, and umbilicus also looks good. There is no edema, and now I'm going to make the 4 quadrants, and then I'm going to listen first. Full 1 minute in each quadrant, and okay, I listen the skin to skin, and his abdominal sound is present in the all 4 quadrants, and this is the nor hyper, no hypoactive. It's like normoactive. Now I'm going to palpate the gently palpate. Yes, there is no any tenderness and no lumps in his abdomen. And now I'm going to move to the leg. Okay, can you lift your leg, both leg? Okay, and you have the good range of motion. Now I'm going to check the range of motion of the finger. देखिए ना तुम्हारे घर में range of motion of the finger. You have the good range of motion. Now I'm going to check the capillary refill. It's within 2 seconds. That's a normal. Now I'm going to feel the dorsalis pedalis pulse. Yes, it's present. And now I'm going to feel the posterior tibial pulse. Yeah, it's present in the grade is 2 plus point. Dorsalis pedalis also 2 plus point, and anterior tibial also 2 plus point. And can you move your leg toward my hand? Can you move your leg toward? Okay, you have the good range of motion and good strength of the leg. Now I'm going to move to the hand, and while I'm inspecting his leg, there is no redness, no swelling, no pressure, also no lesion. Now I'm going to. Can you lift your hand? You have the good range of motion. I'm going to check the range of motion of the finger. You have the good range of motion of the finger. Capillary refill within a 2 seconds. That's a normal. Within a 2 seconds. And now I'm going to listen the. I'm going to feel the radial pulse. Yeah, you have the 2 plus radial pulse. That's a normal. Now I'm going to check his muscle strength. Now I'm going to push toward you, and you're going to push toward me. Okay, I'm going to check your muscle strength. Yeah, you have the good muscle strength. Okay, now while I doing my head and toes assessment, I inspect his all the skin is clean, dry, clean, and skin texture is matches with his ethnicity, and there is no redness, no swelling, no lesion, no pressure ulcer. It's all the normal. And I'm going to check his dehydration. Skin elasticity is good, and there is no tenting. That means he don't have any dehydration sign and symptoms. Okay, at this point I'm going to finish my head and toes assessment, and I'm going to make the patient beds in the lowest position, and everything looks normal, and I'm going to check the safety check. Now I'm ready to leave that room. Okay, bye.